Really excited right now. This is a very special moment for me. We have a star in our midst, Miss Ann Williams-Isom, and as you,
I thought he was talking about me.
Come on, Jeff, it's not about you, it's about Miss Ann right now. Miss Ann is in the building.
Oh my goodness.
Someone who has been a mentor to me, someone I talk to multiple times a week still. She was a lawyer by training.
Not about work, though. We talk about family stuff. So we're neighbors. That's what it is.
Lawyer by training. You spent some time in city government. Obviously, you were the CEO of the Harlem Children's Zone. So really excited to have you with us here today.
Happy to be here, especially for the launching of this very important work. And Jeff, it makes me think about, many people may not know, but I was at the Administration for Children's Services for over 13 years. That's actually where we met. And you and I co-chaired the Neighborhood-Based Services Subcommittee together that the commissioner put together. And I've been thinking about what Dr. Chetty just talked about, the importance of data at a community level. And I don't know if you remember, I came to you with this idea that we were doing in government. It was called the Top 18 Strategy. And we got data that showed us where the majority of children who were coming into foster care were coming from. And Jeff obviously was at the Harlem Children's Zone, and we were able to use city data, child welfare data, to really even say, like on 143rd Street between 7th and 8th, these are where kids are coming into care. To really then focus our strategy on that. So this what Dr. Chetty was saying about the importance of neighborhoods and what a neighborhood really looks like and how do we use community level data to make changes is something I've been thinking about and happy to have this moment to talk to you guys about.
Well, you know, so interesting, Ann, because I never worked at the city level, right, for city government, but you were actually working in New York City during a time when child welfare numbers for Black and brown folks were off the charts, and they were going into these systems and we knew they were having their lives destroyed. It wasn't like they were going there and things were better. And this idea that I remember when you came there, you said, we've got to figure out not just what the data says, but what we need to do about it. And that's why I think this idea of going from networks down to neighborhoods, it's at the neighborhoods that you actually can see real difference.
So I want to tell you two things. At that time, there were 1 in 10 children in this community that were coming into foster care. And so the side thing, I don't know if you remember this, was that we also wanted to arm the community with the data so that they could hold ACS accountable. Because it was like, why weren't we getting the services into that community that we needed? And Jeff, the only thing I think about today, and I'd love to hear your thoughts on this, is that was a great strategy. It was using data, it was going into the communities, it was putting the services where they needed to be, and government is the right person to do that. But you know, we never had a conversation about systemic racism and how the neighborhoods were like that because of what communities weren't getting. We didn't talk about how the policies were keeping people in those situations. And why was it that, you know, all of these communities, 80% of them were Black and brown children, and 80% of the kids that came into care were in care, Kwame, because of neglect. And that's code word for poverty. You know, and I feel like we kind of missed that 20 years ago.
I mean, I think we didn't miss it. I think we couldn't talk about race and racism. Then, remember, Giuliani was mayor of New York City. We couldn't talk about race then and think government was going to respond to us. So we had to try to fix a system that was designed in some ways to impact these certain communities without being able to call it by its name. And that was a mistake, right? I sometimes feel like maybe I should have had more courage and just simply said this system was designed to be racist in the way it treated children. But to be honest with you, I just don't think we would have been able to do what we ended up doing, which was actually reducing the number of children in care if we had confronted. You know, America's still struggling with just naming some of this stuff that it's based on race?
It's so fascinating because I think then if you don't really look at what's happening, you come up with other ideas. It's because Black people were poor. It's because they didn't have jobs. It's because, right? All of these things, not thinking that what they really needed was services at the local level in order to be supportive of their families. And I think that's why when I came to the Harlem Children's Zone, I was like, all right, we got
Ready
this,
to go.
right? Talk about anti-racist
Ready to
poverty.
go.
This is, policies. We were ready to face it by saying, we love these kids and these are our children. And so there is no plan B. So we're going to do what we need to do for our kids.
And what is the opportunity that you all see that we have now that is different from when you all first started?
Well, I think, Kwame, that for the first time, America is coming to grips with the fact that race determines a lot of these policies in a way that's disadvantageous to people of color and to poor people. And you can say that now, we can point to that now, we can actually say that that was designed to hurt certain groups, certain communities. Toxic waste sites didn't accidentally end up near Black and brown communities, right? That was a decision intentionally made that undermined those communities. And I think we just have to say that stuff today. And luckily, I think that there's a movement in this country to name some of that. Now, it's not like there's not a lot of pushback, and we're going to get a lot of pushback.
Right.
But the truth is, you can't go into these communities if you're going to be afraid to name race as one of the key variables.
We could talk about health disparities. We could talk about child welfare. We could talk about housing. We can talk about education, right? You had a great talk last week about educational inequities. And I think, Kwame, right, we have to have more courage, not just to name it, that's the first thing, but then to say, what do we want to do? And I'm trying to keep away from the word dismantle, but I'm saying that there were just some things that were not designed for our children and to ensure that our children were successful. And if we don't do that, what will happen is you will continue to get kids to and through college, and then we put them into this racist world that don't want to give them jobs, that doesn't want to respect them. I'm not sure that we get to where we want to if we don't start to have these conversations about how race really affects so much of what we're doing.
That's really powerful. So I'm going to correct you. Say we. It is still we. Miss Ann. You are still very much on the front
I'm
lines of this
sleeping. I'm sleeping at night.
No, we're not letting you off the hook, Miss Ann.
I'm sleeping in a
We know where Fordham University is. I'm from the Bronx.
Thank you so much for spending this time with us. It's always a pleasure to have my mentors together. And we love you.
It's a blessing, and I love you too. Good luck to all of you that are doing this work. It's very important, and there's no more important work that we're doing right now in America.
Awesome.
Thank you.
Awesome. So taken from what we just heard from Dr. Chetty about